All right, we'll start standing today. Do a quick check-in of your body. Feet pointed straight ahead. Feel the weight, close your eyes. Take a full breath in. And just notice, where is the weight on your body today? Are you starting fairly even? Are you heavier on one side? Just do a bit of a check-in. And then let's go after what changes in your body. So if you take your hands behind your head and pull your elbows back, keep your eyes closed, pull your elbows back as if they're going to try to touch the wall behind you. And first just recognize, does that happen in a similar fashion between the two sides? I can already tell that there's a little bit of a difference between the left and right side. Up in my shoulders, but as I do that, bringing my shoulder blades back, it evens the weight out between my feet. So check in with your body. If we move the upper body into a little bit of extension, does that change something that's going on below? My low back just cracked actually also. From that position, go ahead and relax your arms and pigeon toe your feet, toes together, heels out, and just check that. Grab any jacket for right now and all. Okay. Have the weight evenly on your feet. Roll your feet to the inside and just pay attention to what's happening in your hips. Do you have different sensation between one hip and the other in this position? Is it tighter on one side? And then again, does that change when you take your hands behind your head, pull your elbows back, relax your stomach, or is it the same? So that would give us information if the pelvis and the shoulders are talking to each other. And if they're not, if we try to give this thoracic extension, but it doesn't change in the hip, then we would need to do more to connect it. So all of that's just information for you about what's happening in your body today. Was it difficult to go pigeon-toed? Did it feel super weird? Does it feel weird just to have your feet pointed straight ahead? From this position, then let's start with shoulder shrugs. Pinch your shoulder blades together, relax your stomach, slide them up toward your ears and press them down. Lift and lower 10 times. Feeling the shoulder blades hug toward the spine so that you're making that thoracic extension happen. Getting it to be as even as possible between the two sides. And then I'm going to add one more element to this. Imagine that you're standing in a doorway. If you had a doorway super close to you, you could actually use it. Press your hands out against that doorway and then slide your shoulders up and down again. That pushing and pulling will give you access to some different muscles around the shoulder blades that help that upper back move more into extension as well. And release. Good. One more set of those. Squeeze, take those hands up, press out, slide the shoulders up, push them down. That's a coordinated action between a lot of different muscles. Feeling if they can be as even as possible between the two sides. And release. Good. Now we're going to address any rotation that might be in your lower body. So go ahead and go into a standing quad stretch. Now you could absolutely hold on to something. This isn't so much just about a balance, but you could also hook your foot up on the back of a chair or something like that so that you don't have to hold it. If you do have to hold it, one or both hands, and press your knee down toward the floor so that it opens up the quad or this whole anterior compartment of the hip. Standing on that other leg. Sometimes we use this as a test also. We want to see, do the hips stay basically level? Does that other leg shift way out to the side, or does the glute lose its ability to be stabilizing in that fashion? Go ahead and take it up. And this, again, is working all the muscles from one side of your body, up your back, in between your shoulders, all the way to the base of your head. And release. Switch sides. Find some way, hold the wall, hook your leg up on something. Just do it as a balance. Second side. Tuck your tailbone, open the hip. I've talked about before that we use this for almost anybody that has hip pain. Feels better with a quad stretch based on just how the femur bone is pulled up into the hip socket and the hip and the pelvis start to work together. That's what we see in a degenerative hip, or a little bit of an arthritic hip even, is that the leg bone and pelvis start to work as one unit instead of separated. And we want to teach them that they're separate pieces and they can slide and glide over each other. Excellent. Release it down. Then standing elbow curls. Fold your fingers to your palms. Bring your hands to your temples. Let's open up our upper back. Relax your belly. Make sure your feet are pointed straight ahead. Elbows all the way together so they touch, and all the way back. All the way together, all the way back. 25. Four, 25. Excellent. Release your arms right into arm circles. Fold your hands into the golfer's grip so the fingers hug into where the calluses are, or where the fingers meet your palm, but the palms stay open, and that creates this tightening of all the tendons around your wrist. Then a little squeeze between your shoulder blades. Bring the arm up. Hug the arm bone into the shoulder. Find those rhomboids, those muscles that hold the shoulder blades closer to the spine on both sides. Relax your belly again. Circle forward. Let's do 20 small circles. And then 10 really big circles. Keeping that little squeeze between the shoulders and out and around. Feeling that deltoid across the top of the shoulder, lifting that arm up, elbows stay super straight, and then backwards. Little squeeze between your shoulder blades again, bring the palms up, elbows super strong and straight, squeeze the shoulder blades to your back. Feel that that's happening as evenly as possible, sliding over your rib cage, relax your belly, and 20 circles backwards. And then big circles, 10 really big ones, up and back and around. Muscles from the shoulder blades that run down the spine affect the pelvis all the way down into the lower legs. Mostly we see compensation happening in the upper back, although there is some main dysfunction or scoliosis that occurs there. Good. We're going to go into a balance again. So more lower body, keeping the upper body. Find the balance between where the shoulder blades can squeeze and where they can also press apart. And then stand on one leg. Side leg lifts. Finding your balance, keeping all of the muscles around the pelvis. They need to turn on. And then out and in 10 times. So on this coronal plane, like you have a crown on, like your body's pressed between two pieces of glass, lifting that leg up, everything else is stable. Spine is stable as possible. And then switch sides. Foot pointed straight on the floor, finding your balance, and then lift. We have a visitor. Hi. Excellent. Stand on the first foot again. This time, just take the leg as far into flexion as you can, bringing it up like you're lying on your back in your bed. One hip going into flexion, one hip going into extension. Feel the butt muscles on your standing leg start to turn on, and the hip flexors on this bent knee turning on. And then you're just going to take the leg back behind you. So into some hip extension, and then bring it back up all the way into hip flexion, pulling it up. And again, you're welcome to hold a wall or a chair for this, or just work on your balance. Bring it up, hip flexion, and extension. Behind you. Good. 2 more. All the way up, all the way back. 1 more time. And back. Second side. Standing leg stable. And then bring that leg up, hip flexion. That other leg being really stable on the floor. If it's in the right position for the muscles to grab, the glute on that leg should be grabbing on this standing leg. And then this one going into hip extension, taking the leg behind you, coming through hip flexion. Let's do about 5 of those. Excellent. 2 more balancing things today. Bend the knee, standing on it, and then lift that leg straight out to the side. So your hamstring's going to be doing a lot more here. Still stable as much as you can, like taking your leg out, say dog pees on a fire hydrant, kind of out and in 10 times. Shoulders can just be relaxed, out and in. And release. Second side. Hold it up, hamstring curl. Feeling that hamstring work, and then out and in. Good. Last one, coming across in front. All the way in front of you, find that adductor, just down to straight, and then cross in front. 10 times. switch. And then just check, come to standing, and just check if that's already started to balance you out a little bit or made the weight more even on your feet. And then go up on your toes. So all the muscles from underneath your foot, up the lower leg 10 times. As you go up, it should trigger all the muscles. Whoop. Keep those ankles strong. Up the lower leg, into the glute, up the back, in between the shoulder blades. See if I can stay in view. Good. Move that femur bone out by turning your feet out. And then up. And just feel, do your leg bones rotate out evenly? My right one doesn't want to go out as easily as the left. Pulls on my knee, that glute has a harder time contracting, maybe because of other tight muscles in the front. How is it for you? And then pigeon toe, toes together, bring the weight to the inside of your feet, 10 lifts. Excellent. And then legs to straight. 10 squats. Down into a free squat and up. Feel your ankles hug towards each other and your knees push out. If your knees start to dive in, really work those lateral hip muscles by pulling those knees out a little bit so that as if you were to drop deeper into your squat, those knees would come out more. So find that place where your knees can be straight or slightly beyond your feet, ankles hugging toward the midline so that you have work happening all the way down from the ankle up to the knee. Down and press. Let's do 5 more. 1. Feel your quads, feel your glutes. And then hang in there down into that free squat. Bring your arms up. Find the balance between arch of your back and tuck of your tailbone. There is a happy medium in there. Shoulder blades can come back a little bit. Sit down a little bit more. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Coming up. Excellent. Let's address any little bit of rotation that's still there. Put one foot in front of the other. And then find your butt muscles. Squeeze and release your glutes. There should be 50-50 weight between your feet. These are called inline gluteal contractions. This hugging to the midline, pulling your adductors in, lengthening your abductors, forces your body to stabilize a little differently. Making sure, again, the weight is even between your feet. So it's like you're standing on a balance beam. And then find your glutes. Tighten and release your butt muscles. This is a kind of a different position to use the glute because the glute is a hip extender normally, or a slight external rotator. So finding it when the hip is actually in flexion is a funny way to find that front glute. So really try to work it. And as you feel it squeeze, that sit bone pulls toward your tailbone, it should move your whole leg out. And probably your quad wants to help you, but you could even soften the knee a little bit so that you separate the quad muscle from the glute. And see if you can just get that butt muscle to pull that femur around. And maybe you even feel it on the inside of your knee as it tries to change that position of the leg bone. lining up the hip and knee and ankle a little better. Switch sides. One foot in front of the other. 50-50 weight between your feet. And then once again, find your butt muscles, squeeze them. And I'll say it again just because it's interesting to feel. We want the butt muscle to be separated from the thigh muscle. And very often, they want to work together. So you can even bend your knee slightly so that you get the front glute to squeeze. Both glutes are squeezing, but front glute squeezing independently of that thigh so that they're not working together, or what we call co-contracting. And then switch sides again. Let's do one more set of 20 on each side. 1 foot forward, 1 foot back. Square your hips as best you can. Squeeze and release those glutes. Now, do you have one leg where the thigh wants to be active and one where it can just be relaxed? Can you actually squeeze both butt cheeks? Are they working, or is it difficult just to do that? So you have muscles that connect up into the hip up here and go down the thigh or across the leg, those two joint quad muscles or thigh muscles. And if they're tight, it's hard for the butt muscle to be active. So we have to lengthen the front, engage the back. Good, switch. Shoulders relaxing down and back. Stomach relaxed while you're here. Take a breath. Squeeze, release. And there are some people that have a true leg length discrepancy where one side is actually shorter than the other, but mostly we see a functional leg length discrepancy where like those same front hip muscles are pulling one side of your pelvis down, and it makes it look like there's a leg length discrepancy, but it's really tightness or position on one side. And 20. Excellent. Onto your hands and knees, cats and dogs. 20. Round and arch your back slowly, feeling it move through your whole spine, flexion and extension, feeling your shoulder blades come together on your back. Head up, letting the muscles in your neck gently go into extension, lengthening the front, all the way around, all the way down. And then let's go into a V knee. Take your left foot up, bring it up, bring your hips back as your left hand goes forward, and just lengthen the space between your hip and your hand. Take a full breath, pulling your hips back, opening up the side of your body, breathing, and then setting that leg down and switching sides. Right leg coming up, hips going back, right hand going forward. Really lengthen and switch. Left foot coming up, reach and switch. and switch. And last one. And then both hands on the ground. Find your low belly. So let your belly hang all the way down toward the floor. And then from the bottom of your belly, as if you're zipping up your zipper, pull the low belly up so that your spine comes to a flat position. And then do that again. Let your belly hang toward the floor. And then from your pubic bone up to your belly button, zip that up like you're organizing your front body, knitting it together to pull that leg up. So you have some control of that low belly area. Engage it and then release it back down. Let your pelvis fall, let your hip bones go over the top of your femur bones. And then again, draw the belly up and in and release again. Draw the belly up and in, hold that. Now keeping that work there, go into your push-up position. So that may be here, that may be knees out, or all the way into your plank position. 10 push-ups. Breathing. Rest. 10 more. Take it out. Again, any position, kneeling here, or even back like this, just something to let those arms move. You choose where you're at today. And then, if it's available to you, child's pose. Taking it back, bringing your hands down by your heels, and just breathing. Feeling the full flexion in your body. Knees as far as they'll go, thigh muscles that stretch over the knee and across the hip, the back muscles. We actually give people a child's pose sometimes when we see a lumbar disparity or one side higher than the other in the back. Maybe not so much scoliosis, but just a difference between that right and left side. And so some people, we can treat that in flexion better than in some extension. Good. Take it all the way forward, coming into your floor block. Stretching your arms out in front of you, pigeon-toeing your feet. And just feel your arms pressing down into the floor in this position. You can even pick your head up. So pressing down into the floor here turns on the muscles that are on the side of your body. That's called your serratus. And that serratus has a role in the movement of the shoulder blade. So just hold it up there. You can bring your head up for a moment and just press and hold down into the floor until you can feel that muscle on the side of your body, and just notice, is that feeling even between the two sides? So we have lots of muscles that connect up and around the shoulder blade, and the shoulder blade and the arm bone have to coordinate in their motion, scapula glide and humeral position, for there not to be impingement in the shoulder, for the rotator cuff to do what we want it to do. Keep pressing down. How is that? Similar? Is it getting more even? Is one side getting more tired? My right side is getting more tired than my left. Okay, now go ahead and put your head down, turn your arms outward, and keep a little bit of rotation and downward pressure in toward the floor. Let your head just relax. Hold and breathe. Big inhales and exhales, feeling those front ribs just gently tuck under a little bit, feeling those arm bones, and then move out to the corner of your mat. You can lift your head up, same thing here. Press straight down into the floor and just feel, is that even between your two sides? Let your ribs stay down. Feel the side of your body, that serratus muscle engaging. Maybe mid-trap starts to engage a little bit also. So downward pull from the arm bone into the floor. And then release that pull a little bit. Turn your arms all the way out as far as you can. And then re-engage that slight downward pressure. So not as hard as when the arms are forward, but keeping that little bit of outward and downward pressure happening. You can relax your head. Breathe. Feel the inhale and exhale through your nose into your ribs, expanding your ribs, expanding all the spaces between your lungs. And then take it straight out. Same thing. Head can be up a little bit. Find that downward pressure into the floor. And just notice, is it even? If you have one shoulder that's forward or rotates in a different way or has an angle that's not quite correct, then probably this will be different between the two sides. And then rotate all the way back, head down, that slight downward pressure with that rotation, holding your hands back. Front ribs stay tucked under. Bringing the breath into your back body. And release. Press up, cats and dogs one more time. All the way up, all the way down. Hopefully that feels like the shoulder blade slides over your rib cage more easily. Maybe your upper back feels like it opens more. And then come onto your back. Find where your shoulders can just relax on the floor. Bring that. And then pull your legs up into a table position. So once again, feel like your low belly has that zipper and that you can zip up the low belly. And in this position, your back can be fairly flat to the floor. Just hold a bit of stability there and then drop one leg and hover it.
and then bring it up and switch. Hover, switch, hover, pull it in and out, and in and out, in and out, in, out. One more each side. And release. Pelvic tilts. So now the leg bones are going to be stable, and you're going to move the lower body so that you flatten and arch your back and feel the pelvis move independently from the leg bones. And your sacrum, that's the bone that goes into your pelvis where your spine comes out of, that should be just gently rocking kind of on the two sides where your pelvis and sacrum comes together. Excellent. Into active bridges. Feet on the floor. Lift your hips up off the floor. Find your butt muscles. Up and down. Let's do 20 of those. Lift and lower. So you're finding that posterior chain, lengthening any of these muscles we talked about up here that cross the hip and the knee joint. Finding that glute. Down and up. All right, let's push that. You could choose here, do another set with both feet on the floor, or do one set where you're lifting one leg up and really working just one side independently. 10 times. Switch sides. And then coming down, put the bottom of your feet together. Allow your knees to drop out into a frog. Just allow the weight of your legs to pull on your pelvis. Hopefully that pulls you into neutral evenly. Big breaths into your belly. Let your belly expand. You can feel your hip bones and see if they're straight across from each other. Check your rib cage and make sure that it's in line with your pelvis so there's not an offset happening as your body releases on the floor. Sometimes if you start with one psoas tighter than the other, or some lumbar erector that's pulling you into an offset position, as that relaxes out, you notice you get crooked on the floor. So we want to make sure to adjust that so that we're asking this even symmetrical body that might not be so even or symmetrical when we start, but that's the goal, working towards it to be in alignment on the floor. Go ahead and bring your legs in and then grab your strap, and we'll do a set of abductor presses just to keep your pelvis in that really good neutral position today. If you don't have a strap, use a pillow and do squeezes instead. That would be just fine. Put that strap so that it's fist width apart, feet on the floor. Again, double check shoulders in line with hips and pull out against that strap, press and release. Press, release.
I just wanted to mention that a belt can work in place of a yoga strap if you don't have that.
Totally. Thanks. Keep going. One more set of 20. Press and release. I've also had people use like tie down straps because they often have that metal piece that holds it taut. Excellent. Release that. And then into foot circles, point flexes. Go back into that standing position that we had one leg straight and one leg out. We're doing it on our back this time. Shoulders down and back. Let them find that space where they can hug down away from your ears and in toward your spine just a little bit. Let this leg come up as far as it will go. Keep that bottom leg active and straight up toward the ceiling. And then 20 circles clockwise. And reverse. And point and flex. And switch. Bringing that leg up, shoulder blades down and back, big circles all the way around. This exercise we use a lot for reteaching foot strike because so many of us have one or both feet that just aren't going heel ball toe when we're walking or aren't pointing straight. Reverse your direction if you haven't. Do 20. Point and flex. All those little bones in the ankle and the muscles of the arch get worked so that we're lining up the foot and the ankle and the knee and the hip, and relearning foot strike. Heel, ball, toe in our walk. In our run, we want to be more ball of the foot. Unless you're doing a function run where you purposely do really slow and go heel, ball, toe to just retrain that foot strike as well. Okay, into a downward facing dog pose. Let's tie it all together. Hands on your mat, tuck your toes under. Work those ankles that you just moved. Press through your fingers. Let those side muscles that we worked in floor block lengthen up toward your ears so that shoulder blade can move all the way up. Come forward into plank. So as we pull the arm down, we're going to work that serratus a little bit. Come forward into your push-up position and then press back up. So that's exactly that serratus muscle, pulling the arms down, finding those muscles on the side of your body, pushing it back up. One more time. Down and up. And just breathe. I'm going to check the time.
Nice. Okay, come into whatever position you would like to be in for a little bit of breathing practice today. Sitting or lying down. We're going to borrow some Wim Hof technique today. Let's do 3 rounds of 20 breaths with a hold in between. So, let me get my timer here. I want you to take a deep breath in and then let it go. Deep breath in, let it go. In, out. In, out. In through your nose, out. Inhale, out. In, out. In, out. In, out. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale all the way. Blow it out. Hold for 30 seconds. If you have to breathe beforehand, that's okay. But if you can hold it, hold for 30 seconds. Keep blowing out. Out. Ten more seconds. Inhale. Breathe normally. Nice. That was round 1. 20 more breaths. Inhale through your nose. Out. Inhale. Out. In. Out. In. Out. In. Out. In. Out. Halfway. In. Out. In. Out. In. Out. In. Out. In. Out. In. Out. Inhale. Exhale, hold. See if we can make it 45 seconds this time. Of course, if you need to breathe, go ahead. Try to exhale a little more if you need to. Coming up on 30 seconds. Ten more. Oh, 5 more. And breathe. Breathe normally a little bit. We'll do 1 more round. Okay, last one. 20 breaths. This time we're going to try and hold for 1 full minute. In, out. In, out. In, out. In, out. In, out, in, out, in, let it go, in, out, halfway, in, out, in, out, in, out, in, out, in, out, in, let it go, in, out, last one, in, out. Now big inhale, let it go, hold 1 minute. Be right here. See how present you can be. Feel the sensations in your body. Notice if there's a temperature change. Breathe out a little more if you need to. Halfway. Of course, you can always breathe if you need to, but try to push it a little more. There's 45. Five, 4, 3, 2, and 1. Breathe. Nice work.